I am a caretaker. I take care of my sister who is disabled and her son. And when you talk about disparities and trying to get health care, preventative medicine, education, I don't know, but for the grace of God, where she would be had I not been there for her, and to be able to call and get her into the right networks and meet the right people and find out exactly what we should do. Because if not, we would be in the same boat as some of the people that you're going to hear from today in terms of the tremendous job that they have to do to not only inform our communities about the healthcare issues, but how they get help. There's just so much of not even knowing, you know, and I'm not even talking about just not wanting to go to the doctor, because a lot of us don't want to, still to this day. Those who do, they have no way of getting there. They have no way of paying for the cost for medicine. So I just wanted to say that I'm very much involved on a personal level. So I kind of, I have a lot of understanding of what we're going to talk about today, and a lot of concern. And again, that is heartfelt. But enough about me. I want to introduce you to some very powerful speakers who have a lot to share with us today. I've talked with some of them, I should say off camera, and I've learned a lot myself in just the minutes that we spent talking. So without further ado, and I'm going to read their bios, because you know what, you need to know who these people are that are going to talk to you, and at the same time, we need to recognize them for their achievements. Am I right? Yes. All right, okay. Now, on the far end of the podium there is Ms. Loretta Jones. She is the founder and executive director of Healthy African American Families. The program is funded by the Centers for Disease Control and Prevention to study the reasons for low birth weights and infant mortality among African Americans in Los Angeles. Ms. Jones found that a wealth of information and resources exist throughout the African American community. Unfortunately, researchers seldom seek out the people in the community who already have knowledge and understanding of the problems which affect them. And she will tell you, or she allowed me to tell you, she will be 70 years old come June. So, that's right. Are you already 70?
I made it to 70.
She made it to 70, that's okay. So we're looking at 71, all right? But she has a lot of history to share, and you know, we really, really appreciate you, Ms. Jones. Dr. Antoinette Tony Yancey is currently a professor in the Department of Health Services at the UCLA School of Public Health. She's co-director of the UCLA Kaiser Permanente Center for Health Equity, and her primary research interests are in chronic disease prevention with a focus on organizational practice and policy change. She has served as Director of Public Health for the City of Richmond, Virginia, and as Director of Chronic Disease Prevention and Health Promotion for Los Angeles County's Department of Public Health. Dr. Yancey has authored more than 125 scientific publications and serves on the Institute of Medicine Standing Committee on Childhood Obesity Prevention. And Vincent Jones is our lone male on the panel, Mr. Jones. He's a senior program officer of the Liberty Hill Foundation, where his major charge is economic and racial justice, LGBTQ justice, and environmental justice, especially to organizations and communities of color. Mr. Jones is a veteran of several national, statewide, and local political campaigns. He's currently board co-chair of the National Teen Leadership Program, a founding board member of the Barbara Jordan Bayard Rustin Coalition, and a member of the Los Angeles Steering Committee for Lambda Legal. Welcome to you all. I'm going to open up the floor to you and give you a few minutes for opening statements, and then we will take it from there. I first want to say that I think a major problem as far as the media is concerned is consistency and repetition of message. I think once we present something to the public, like we'll sponsor a fair, a health fair or a nutritional fair or whatever, we'll cover it for a while, and then it goes away and the community forgets about it and the message sort of becomes lost. So the more we talk about things, I know that sounds very minute, but I actually believe that really, really helps. So that will stand to go in a big way. So Ms. Jones, I want to open up the floor to you, ma'am, please.
Hello, everyone. Thank you for letting me come and talk to you today. I want to talk about something that's dear to my heart, community engagement, because I believe that the community is the most important piece in the recognition of how we're going to change health disparities. Health disparities are not going to change because we said so. they're going to change because we help people understand why the disparities exist. I like to talk about under-resourced communities, not disadvantaged communities. I hate that word because our communities are not disadvantaged. Our communities are under-resourced. And when you talk about our communities, try to use the word under-resourced rather than disadvantaged, because it turns people off. And so the messenger, who you are as media, and your message becomes what we trust. And so getting that together is one of the things. I want to talk about resiliency. That's where I work, and
Oh, we hear you.
okay. We have survived 400 years. We are resilient people. We have built ourselves up to do things and do them well. We miss steps when we let someone else describe who we are. We need to help redirect the power in our community. Let's not talk about empowering the community, because you can't give someone something that they already have. We have power. So empowerment is a word that comes outside of our community. So you want to talk about how do we direct the power in the community? What are the things that work well in our communities? We have a lot of things that work well. And we need to look at those things. I want to think about, I talk about from the cradle to the grave. I say that all the time. Looking at health from the cradle to the grave. Please do not piecemeal health in communities of color. It doesn't work. We need to talk about the whole, not a part of. Because people think of STDs as over here. When you report it, you report HIV over here. And maybe you report unplanned pregnancies over here. But all of them had sex. So we got to talk about the whole thing. And we don't. So I'm going to stop there, drop it off, and let the next person talk.
All right, thank you, Ms. Jones. Dr. Yancey.
Good afternoon. Thank you for having me. I'm delighted to be with you. And I really hold this organization in high regard. I've had a number of friends who have been a part of this organization, including one that just passed away within the last year, Leon Winter, used to write for the Wall Street Journal. And I really feel that you all hold so much of the key to what I do. I mean, I'm a public health professional. You know, I've worked both on the practice side and on the academic side. But we in academia, we in government, we're not the best messengers. You know, we really have to find other people to do that. And you all hold the key to that, both in identifying some of the people in the community that are credible for a variety of different, health challenges, but also because you're the one that you are the ones that help to determine what gets talked about. My particular area of emphasis is chronic disease prevention, and about a year and a half ago, I was selected to serve on the board of directors of the Partnership for a Healthier America, which is the nonprofit formed to support the First Lady's Let's Move initiative. This has been a whirlwind last year and a half. I've gone up a couple of rankings on my United mileage thing, just from all the traveling back and forth to DC. We have our first annual summit coming up, and the First Lady will be there November 28th and 29th. November 29th and November 30th. So I hope that NABJ covers that generously, because really this is an opportunity for us to get a step ahead on the next generation. I wrote a blog, actually was looking at that in terms of what I wanted to say to you all today for the California Endowment's fellowship that they do for health journalism, primarily focused on minority health. And in fact, I think I'm here today on behalf of Dr. Bob Ross, who had other commitments. That journalism project is one that helps to pull these stories to the forefront and to get them told, and to get them told in the voices of people who look like, sound like, act like, come from the same kinds of backgrounds as those that we really want to engage. So my message around this issue of chronic disease and obesity prevention, and I'm using that term very deliberately because the First Lady talks about the fact that we need to end this epidemic within one generation. And in order to do that, we really need a lot of help from the private sector. One of my feelings about the way that journalists cover this topic of physical activity, nutrition, and so forth is it's all about weight loss, okay? And not only is it all about weight loss, but it's all about some amazing, miraculous story that happens. You know, somebody that loses 100 pounds, somebody that, you know, starts some, you know, newfangled sort of diet or something. And I really think that, you know, a lot of it could use a lot more focus on solutions, but not just any solution. Solutions that happen at a larger level of our whole society, because this is no longer an individual problem. We all have a problem. And, you know, I dare to say that there aren't too many people in this room could say, honestly, that every single day, the last month, you've gotten adequate amounts of physical activity. Anybody want to venture to say that every single day? Okay, so maybe one person. Okay. All right, anybody floss every single day in the last month? Every single day or twice a day? Maybe one or two people. So you see the problem here, and this is an educated, well-informed group, okay? So we really need to promote things at a structural level. And one of the things that I've been working on is a project called Instant Recess. It's an approach that brings short bouts of physical activity into our daily lives, wherever we work, where we play, where we worship. And I have a book out called Instant Recess, Building a Fit Nation, 10 minutes at a time, because I think that this is part of the solution. And I hope that you all will report more on these solutions, because we know enough about the problem. And when I go out to communities, I know they don't want to hear any more about the problems, okay, but solutions where we show people who are exerting their power and demonstrating how we can create change. I think that's what people really want to hear about. And I think that's what will really start to drive the kinds of changes that will end this epidemic and that will create a healthier future for all of us. Thank you.
Thank you, Dr. Yancey. I think we can surmise that Dr. Yancey is not a big fan of The Biggest Loser.
You got that right.
Right? It's on every day, isn't it? Or every week? It's a weekly show.
Every week.
Okay. Vincent Jones, please.
First, I have to say, I can't believe I'm sitting next to Dr. Yancey because we do instant recess in our office when we have for the past year. So I have to make sure I get a picture and sit with the entire office so they can know where the inspiration for instant recess. But good afternoon, everybody. Thank you guys for sticking it out today to hear us. And in the spirit of instant recess, we got you guys just to stand for a second while I'm giving my introductions off. All stand. So make sure your blood is going. There we go. Just stand.
Not in front of the camera.
Oh, dear. Let's get started. Okay. And now, I'll make sure you guys are focused.
Mr. Jones.
Here we go.
Give us a beat.
Okay. Yeah,
Thank you for doing that.
thank you. Thank you for inspiring us. So that is one solution. So we have at least done one thing. We give you guys one solution. But my name is Vincent Jones. I'm a deputy director at Liberty Hill and also senior program officer. And I want to start by first just telling you very briefly what Liberty Hill is. And I'll do that by pointing out two of our grantees who are here. One is Jan Robinson Flint, the beautiful woman in yellow. She's executive director and founder of Black Mental Wellness. And telling you about Jan and telling you about her organization, I'll tell you about Liberty Hill and also give you a kind of good frame for my remarks today. So Jan and Black Mental Wellness, they recently had two big successes with legislation that are going to improve health in our communities. One of them is they were successful in getting a ban on BPA and chemicals in bottles and baby products, and that's going to have a tremendous impact on the health outcomes and reducing disparities in children, especially children of color. And they also, which I didn't know until today, also had another success. And remind me again, Jen?
$4.99.
Very briefly, come on.
Governor Brown signed Bill 499, which allows providers to provide STD prevention treatment to minors.
Yeah, that's huge.
And so this is one example of a group of women who are impacted by injustice, who are not waiting for others to come and tell them what to do. They're doing it, their sisters are doing it for themselves, and they are building their leadership capacity, engaging other women and others in the effort to win these battles and others. And then we have Freddie Lee, who by day works for First 5 LA, but also by night is a part of Latino Poly Alliance, another Liberty Hill grantee that is doing a lot of work to win hearts and minds around LGBT issues in Los Angeles. And so what Liberty Hill does is join with grassroots leaders like Freddie, like Jan, like many of you in this room, to give them the tools and the resources that they need to power the solutions that they know work. That as Ms. Jones said, they are not, our communities are not disadvantaged, they're under-resourced, and Liberty Hill exists to provide resources. So I'll stop there.
Now, you know what, I want to pick up with what you were talking about with Jan in passing legislation. Is that the next wave of what we should be doing, just in terms of getting change, promoting change, and creating awareness? We have to have it legislated because nobody else is going to do it?
I would say yes and no. Legislation is important because it does change systems. And at this stage, again, we have to do a lot of systemic change. But once the bill is passed, it means nothing if it's just on paper. We have to make it real. So what I would say is that what we need really organizing, where you're building the power in the community to get the bill passed and to make sure it's implemented correctly after it's passed.
Good point, because I remember talking about that, Jan. I do remember that passing, but only briefly, and I think we may have mentioned it, and that was it. So it's about redirecting, and again, consistency, repetition of message.
Yes.
Okay, thank you. Dr. Yancey.
I'd just like to echo that. I mean, I think that's really very important. And when you look, for instance, at tobacco legislation, anti-tobacco legislation, for many years, it was much stronger in Europe. I mean, from a top-down approach, they had much stricter laws in place and a whole lot more smoking if you've ever traveled around in Europe. So the reason many of us feel for the difference is that there's a grassroots level of social norm change that occurred here. Okay, so it wasn't just coming top down, it was coming bottom up, which means that it's not just going to be on paper, it's going to be actually implemented, and there's going to be social reinforcement of those new norms of non-smoking. Similarly, we need the same kind of thing as it relates to physical activity and healthful eating. I mean, I'm sure 10 years ago there would have been plenty of sodas on these tables. Okay, and now there's a consciousness around that. You know, there's this whole campaign, Rethink Your Drink. Okay, 30 years ago, people would have been smoking in the rooms. Okay, so we have made a huge amount of progress, and some of that progress is legislative, but what happens before the legislation is really what determines whether or not it's on paper or not, and that is the organizing, that is the figuring out how to start to adjust social norms. And that's what we're trying to do with Instant Recess. That's what we're trying to do with the Rethink Your Drink and a lot of these other campaigns, is to get out ahead of some of these issues too. How many of you all, the younger of you, know what one for the road means? Raise your hands if you know what one for the road means. Okay. The reason that some people don't is because we've been so successful in the drinking and driving thing. Okay, it used to be you were handed, when I was in medical school 30 years ago at Duke, you were handed a drink on your way out the door to drive to the next party or home. It's no longer socially acceptable, right?
I'm sorry.
I would like just bring your mind to the Affordable Health Care Act. That is so important. If we do not tell the community what does the Affordable Health Care Act mean to the community, what are the do's and don'ts, not with scare tactics like they're going to take all the things away from seniors and seniors are going to have no resources, but what are the things that community can advocate for? What are the things that they will have? If we can't tell them what to advocate for, they're not going to know, and it's going to make a big difference in our lives. I'm afraid that, for me, I've been around for eons and eons, and I can remember when African Americans had to go to a separate door in the hospital to get health care. Now where you can walk in the hospital and maybe get health care. And I say maybe with a big, yo-yo. But how do we tell our communities that it's okay to ask for and to demand the best care possible? That we're supposed to demand for children who have asthma, all that asthma is supposed to have for them. That includes a peak flow needle. That includes a spacer. How many people know that those things are supposed to be a part of the health care for an asthmatic child? Am I wrong, Tony?
No, you're absolutely right.
And how many people know about it?
Very few. Very few.
And they don't even know that there's a form that every parent should have that they take to school with them, they take to their child care places, that talks about whether or not, if you're in the red zone, the yellow zone, or in the green zone. And how many people know what that is? The red zone means the child needs to go to the emergency room immediately. The yellow zone means there's rescue medicine that child's supposed to take. And the green zone means that child's supposed to take its daily medicine of Advil or whatever the heck it is. But we're supposed to know what these things are. We're supposed to be able to save our children. There is no reason why an asthmatic child should die in California. And yet this year so far, there have been 21 deaths of children. Now, if you put all those children together in a room and said, okay, a classroom died, everybody would be on the news talking about it.
Yeah.
But because it's individuals, no one talks about it. We have to start looking at the collective pieces and actually report on the collective pieces, not in a way that's scary, but in a way that says, okay, we know that these children shouldn't have died. Why did they? And what can we do to prevent it for the next child?
We have a lot to do, Ms. Jones, don't we? This is Dr. Maya Elise Walton, who just walked in. Hello, Dr. Walton. Tell you a little bit about her briefly. She's a board-certified physician, born and raised in Washington, D.C., attended Howard University, where she earned her Bachelor of Science degree with honors. She served as a member of the board of the Association of Black Women Physicians and its Waiting to Exhale program committee, an annual community outreach project to combat overweight and obesity. And Dr. Walton, what we've done is we opened up the podium for everyone to make a statement about what they would like us to know, what they would like us to cover. So we're just in the middle of a discussion, but we'd certainly like to hear your opening statement.
Okay, well, I apologize for my tardiness. I'm coming from another meeting, which I had to leave, actually, to get here sort of on time. But I wanted to add to what both of these women have said with respect to getting the appropriate care, and a lot of it has to do with knowledge and education and knowing what's available. One thing I wanted to make sure everyone was aware of, there's a program here, CHDP, Child Health and Disability Program, which depending on if you don't have Medicare, or Medicaid rather, or Medi-Cal, up until the age of 19, you can actually get free physical examinations and vaccines. And there's a periodicity chart, so depending on how old you are. For an infant, it's every 1 to 2 months, depending on how old they are. And then once you get to about the age of 3, you can get at least an annual physical and your vaccines at least once a year. Once you apply for this coverage, it actually gives you approximately 30 days of Medi-Cal coverage. And in that time, you can also go to the dentist and get other services that you need, the eye doctor, your prescriptions, and what have you. Within 7 to 14 days from applying for this program, which you can do at many clinics and many doctors' offices, including mine, you are supposed to receive a packet in the mail that the parents can complete to continue some sort of coverage, whether it's Medi-Cal, Healthy Families, or whatever you can qualify for based on your income. And so in order to qualify, all you have to do is come to the office, tell us how many people live in the home, how many children are in the home, monthly income. 99.9% of the time, all the people that come qualify, and you can get what your child needs. So that's part of it. Another program is California Children's Services, or CCS for short, where depending on your diagnosis, irrespective of insurance, private, public, irrespective of citizenship even, depending upon your diagnosis, So if you have a birth defect, or you're born with cerebral palsy, even some severe asthmatics, or some genetic or inborn error of metabolism, you can get seen by all of the specialists that are related to your intrinsic medical problem, again, irrespective of insurance. And even if you have insurance, it can supplement things like durable medical equipment, like wheelchairs, nebulizers, and other things that are a little bit more difficult to get covered. So there are a lot of options there, but you have to know about it, and your physician has to know about it, and they can help you figure out how to acquire these services.
You know, that's part of some of the issues we were talking about today, Dr. Walton, knowledge and how do people find out about these programs, because we're not going to always talk about them. You mentioned some things that I only know about because of being personally involved, but I know my station is not going to go A, B, C, D on those facts that you just mentioned. We're just not going to do it. Health fairs, yeah, talk about it then and then it goes away.